further questions, probably as we did last time, I would want you to key in your questions in the chat box, and then we will take it forward from there. Till then, I want you all to patiently listen to this talk by Dr. Krishnan, because it's going to be something that's very useful for us, for all of us. It's not just for you and for me, but for all the participants, because this is something which is the need of the hour, right? Okay, let's wait for the team Ramakrishna Hospital to join us. And we would appreciate if you could mute your mic and turn your video on so that it's a weekend afternoon. So to have something pleasant to look at, it's better to have the videos turned on, right? So turn your videos on and you might mute your mic. All right, thank you so much. We'll be having these talks quite often on various topics of interest to all of us. So, good afternoon. Good afternoon. We will update you well in advance as to what these topics are and who is going to address them. We'll be updating you also.
Good afternoon, sir. Good afternoon, sir. Good morning, sir.
என்னைக்காவது நாங்க சாக்லேட் வச்சிருந்தா கேட்டுட்டு தானே சொல்லுவோம்.
உங்களுக்கு பாருங்களேன், இது ஜீரணமே ஆகாது.
அட்லீஸ்ட் ஒரு கர்ட்டசிக்காக இல்ல வேணுமான ஒரு வார்த்தை ஒருத்தரையாச்சும் கேட்டீங்களா? இல்ல மீனா இனிமேல் நம்ம என்ன பண்ணலாம்,
இனிமே நீங்க சாக்லேட் கேளுங்க. சாக்லேட் வாங்குறீங்க பேக்ல எத்தனை சாப்பிடுறேன்னு தெரியாம எடுத்து வச்சுட்டு வந்துட்டேன். நல்லாவே இல்லை, இது வேணும் இது வேணும் மேலேயும் வேணும். ஐயா சாக்லேட் சுப்ப கூடாது
சார். ஏன் சார் வேஸ்ட் பண்றீங்க?
வேணும் கேட்காம சாப்பிட்டா இப்படிதான் வேணும்.
இது
நாங்களும் சாக்லேட் வச்சிருக்கோம்.
அந்த சாக்லேட் தான்.
என்ன சாக்லேட்?
அந்த சாக்லேட் தான் சாப்பிட்டது.
ஸ்ட்ராபெரி சாக்லேட்டா?
இல்ல இல்ல
அன்னைக்கு ஆரஞ்சு சாக்லேட் எங்க சார் அன்னைக்கு கொடுத்தது?
அவருக்கு பேல போட்டுருப்பாரு.
அவரு சாப்பிட்டதே இவர் பிரத்தி சார் கொடுத்த சாக்லேட். அவர் எனக்கு
Mr. Umashankar, are you there?
ஆஃப் ஆயி தானே இருக்கு நம்மளே இது.
ஆடியோ ஆஃப்
நான் கேமரா வீட்ல இருக்கு. கேளு.
நீ சொல்லிட்டு புரியல.
கமல் சார்
நீ வாய்ஸ் ரெக்கார்ட் போட்டுட்டு
போன மார்ச் 12ஆம் தேதி லாக்டவுன் ஆரம்பிச்சது. மார்ச் 12ல இருந்து ஸ்கூல்.
Please mute your mic.
மார்ச்
Neeraj, grade 8.
நேத்து இவ்வளவு பெரிய சாக்லேட் வாங்கிட்டு வீட்டுல வச்சுட்டு வந்தேன்.
Do we have anyone from Ramakrishna Hospital joined us?
Yes, sir, we are here.
Right. I can't see it because the video is turned off.
Okay.
Yeah. I would request all the participants to mute the mic and turn the video on.
இப்போ என் நம்பர் அந்த தமிழ் போன்ல போட்டாரா? அட அங்க வீட்ல இருக்க போன்லயா?
Can we start, Umashankar? We are on at 3 o'clock.
Sir, just appear.
தமிழ்ல வேணா போனுக்கு எல்லாத்தையும் ட்ரான்ஸ்ஃபர் பண்ணிட்டு இந்த போன்ல ஒரு
Yeah. I'm good. Yeah.
I think we are on. The Ramakrishna team is on, Mr. Rajesh.
Right. So, very good afternoon to all of you. I'm Rajesh Vasudevan, the head of School of Manchester International School, the premium school in Coimbatore in Tamil Nadu, offering both the international curriculum, the international baccalaureate, the first of its kind, a continuum school, that means which offers all the 3 programs of the IB in Coimbatore, the 4th in Tamil Nadu, the 36th school in India, to offer this premium curriculum. And we also have the CBSE program parallelly running in the same campus. We are here in Coimbatore since 2000, for the last 10 years, and it's been a great journey ever since. I welcome each and every one of you to this great afternoon, rather evening, on such a special topic. Over the last couple of years, we have developed bad habits, or rather bad conditions, health styles, and we have tried to ensure that there is something that we can do about it, so that we get back to a very healthy life. It was that thought that got us closer to Ramakrishna Hospital with Health Basics, and we decided to co-join or collaborate with them. I need not talk about Ramakrishna Hospital because that's a name that goes with health, quality, and expertise. So I shouldn't be adding any adjectives to that. That would be very, very unfair of me to do that. But still, Ramakrishna Hospital is a name to reckon with quality health services. So we have this tie-up with Ramakrishna Hospitals, providing, it's not just the physical well-being, the mental well-being is also taken care of. That was one of the prime requirements that we had when we met the Ms. Swati and Mr. Ramkumar, Mr. Anmol, and the entire team. And ever since, we feel the warmth of the Ramakrishna hospitals. It's such a delight to have Dr. Gokula Krishnan here this afternoon with us. I shouldn't be talking much because I'm sure that this 1 hour session that's going to start from now on is going to enlighten all of this and provide some tips to my children, the parents, the teachers, and to all of those who are attending this conversation, this talk today, to develop, to keep the body in alignment with the soul. Over to Ramakrishna Hospital. The podium is all yours.
Thank you, Mr. Rajesh. Good afternoon, ladies and gentlemen, boys and girls. I'm Purnima Raja, and I head the operations at Sri Ramakrishna Hospital. We welcome you all to our first health talk in the series, Taking Care of Human Factors. At the outset, I would like to thank the management of Manchester International School and Health Basics for arranging this. I'm going to take just 2 minutes, quick 2 minutes to introduce Sri Ramakrishna Hospital to you. I am sure the principal has already spoken about it, but just to give you a brief outline of what and who we are. We are a 1,000-bed multi-speciality facility, which is run by the SNR Sons Charitable Trust. At SRH, we treat several thousands of patients year after year. We have well-established departments such as orthopedics, cardiology, oncology, neurosciences, and of course, pediatrics. We use state-of-the-art technology and cutting-edge medical and surgical interventions to treat our patients. And it gives us immense pride to be associated with Manchester International School through Health Basics. Through the series of health talks, we hope to meet your needs and become your preferred health partner to serve you better. Sri Ramakrishna Hospital will be happy to be your one-stop shop for all your medical needs. So to begin our series, I take this opportunity to introduce to you all Dr. Gokul. We fondly call him as Dr. Gokul. Dr. R. Gokula Krishnan is a senior consultant and an orthopedic surgeon at Sri Ramakrishna Hospital. He's a specialist in joint replacement, sports injury management, complex fracture surgeries, and treatment of geriatric surgeries and the fractures associated. So I'm going to take this time to tell you, just relax, unwind, and enjoy this session. Now over to Dr. Gokul.
Purnima, I just would like to, before Dr. Gokul takes over the screen, I would like to introduce my team to all of us. I have with me Mrs. Jayanti Robert, the principal of the CBSE program. And along with that, we have Mrs. 𝗸𝗶𝗱𝘀𝗿, the head of admissions, Mr. 𝗸𝗶𝗱𝘀𝘁𝘂𝗿𝗲, the head of market administration and student school development. We also have Mr. Mukesh, the vice principal, Ms. Neelima. I can see Ms. Neelima here. She is the associate coordinator of the mid-year program of the International Baccalaureate. Mr. Ashok, the DP coordinator. Is Dr. Menon there? Right. So that's the team that is attending from our side. Ms. Aishwarya, the director of marketing, will be joining us very soon. Dr. Gokula Krishnan, it's such a pleasure to have you with us. The stage is all yours.
Yeah. Good afternoon, everyone. I'm Dr. Gokula Krishnan, consultant orthopedic surgeon of Sri Ramakrishna Hospital, and I'm a consultant with special interest in joint replacement surgery and sports medicine and geriatric fracture management and complex fracture treatment. I'm in this institution since 2001. As a medical officer, I joined here, and since 2010, I've become a registrar and I've become a consultant since 2014. And this institute, you know very well, we are a 1,000-bed hospital serving the Coimbatore people since the past 40 years. And we have performed more than 1,000 joint replacement surgeries for the past 10 years with a good survival result. And today I'm here to talk about an interesting topic, which is the need of the hour, which should start from the childhood days. That is, from the younger days, we should learn about the ergonomics of human occupation. So what is ergonomics? So soon we'll know about it. I'll give a brief introduction. And after me, we have our chief physiotherapist, Mr. Sriram, who will guide you in the exercises and subsequent ergonomic management. Let's keep this session interactive. So after the end of the session, we'd like to have more questions from your side, and we are happy to clarify your doubts. So what is ergonomics, which is commonly called as human factor? See, ergonomics is nothing but it's a branch of science that aims at making the people do more efficient work in their working environment. So we have to design the work environment to the worker so that we can extract more efficient output. So here, since it is work related, what is to do with school children? See, obviously in this pandemic, almost all the schools and all the institutions are conducting online classes. So we are stuck to the computer or laptop or mobile phones for long hours. So I see more patients in my OPD. The school children, college students, all coming for the treatment for the neck pain, back pain, and a lot of other skeletal-muscular problems. So the importance of ergonomics is gaining in the school children. So it is nothing but to learn the human abilities and limitations and apply that learning in creating a system for the individual to perform better. So the ergonomist designs or modifies the work to fit the worker, or in other words, we should create an environment for the children so that they are more comfortably listening to the classes and more attentive and their performance better. So, and also the ultimate goal is to eliminate the discomfort in the work or attending classes, and the subsequent micro injuries which will happen in the body has to be overcome. So why it is important to follow ergonomics in school children? See, what disadvantage we get when you have a discomfort in the posture when you are attending classes or doing any reading or even drawing, painting, or any kind of school activities. So naturally, you tend to get early fatigue and discomfort, and the inattention to the classes is commonly made out in online classes. And some kids will develop involuntary movements like wiggling and fidgeting and involuntary movements of the upper limb. And finally, they end up in developing core weakness of the neck and back, and which ends up in causing more degeneration in the subsequent years. And many kids will get visual disturbances due to long hours of exposure to the screen, computer screen or the LED exposure. So in this context, we should learn more about the active sitting. So what is active sitting? So it is nothing but it's micro movements which is happening in the individual while in a seated position, which will help in the physical and mental benefit. So you should know about the active sitting. So many children will keep moving in the chair. They make some micro movements. So which is probably, which we may see it as an unwanted thing, but actually that is good for them. So you cannot sit idle like a robot. So you should make some movements which probably will happen involuntarily. So we should train them to make that movements more beneficial. Like, we should teach them the core exercises for the neck and back and shoulders and the lower limb, so that they do that core group of muscle constantly used during the classes, which we will teach in subsequent slides. So this video is I would like to show the video for active sitting. So this video, this would have made you understand what is active sitting. So you need not be passively or inactively sitting in a chair and listening classes. You should keep some movements happening in your core muscles so that the long-term benefits are harvested. So in this context of ergonomics, we should all know about the school backpacks. We generally, when I was a school child, I was carrying a lot of books, naturally, which will amount 10 to 15 kilograms of the entire the bag. So ideally, what is the weight the child should carry in case when they go to school? So now being online classes, that is not a problem, but still they should know. So generally, it should be 15% of the body weight which is the optimal weight to be carried by any kid to going to school. So naturally, when they are 50 kilograms of weight, they should carry 7.5 kg on average. So where generally our school children carry more weight backpacks. So we should, the school management should formulate such that they should carry the required books, and so that the weight does not cross the 15% mark of the kid generally. So since in this pandemic, a lot of, almost all the classes are online, and we are stuck to the system, computer, laptop, or mobile phones for long hours. So we should know the basics of the computer ergonomics, where the viewing distance, the screen should be at the one arm distance for any kid. The system should be kept one arm distance away, and the top of the screen should be at the eye level, so that they won't bend, hunch too much. And what is the keyboard? Generally, there are ergonomic keyboards available in the market, so which has tilting adjustments are available, and that should be kept on the desktop, which should be 2 inches above the elbow level, so that the shoulder won't be strained too much, and it will avoid damage to the joints of the hand and wrist. And there are ergonomically designed mouses available. The size might differ for the kids, so accordingly it is kept, and it is kept on the desktop, so that the elbow is kept in a 90-degree to 100-degree bending. So you need not hang the elbow down, so keep the elbow on the study platform and use the mouse. And the foot should be rested. The foot, which generally should not hang in the dangle in the air, it has to be rested on a footrest or on the floor to avoid the circulatory problems in the foot. And the children should sit upright. The back of the children should be seated on the back of the chair, with the shoulders rested on the back, and the arm should be kept in the arm rest. That should also be height adjustable arm rest, where it will keep the elbow in 90 to 100-degree flexion, so that there won't be much strain to the shoulder and elbow. And in between the classes, you take a break, you stretch your body by doing head rolls, shoulder rolls, or even you can march in the same place, which our therapist will help you to learn about it. And this way, while doing this stretching exercises, we can avoid pressure to the body parts. And regarding the eyesight, since the LED screens are more harmful to the eye for long hours of exposure, you should take a break every 20 minutes. We follow this rule, 20-20-20 rule. It's not T20, it's a 20-20. So where, every 20 minutes, you should take a break, and you should stare at a wall which is 20 feet away for 20 seconds. Then you can start your work back. Maybe this cannot happen in online classes, but generally the teachers also can follow this 20-20 rule, where when the exposure is more than 20 minutes, give a break for 20 seconds and make them stare at the wall for 20 seconds, which is 20 feet away, which will avoid strain to the eye, and maybe the headaches and such problems cannot happen. And there is a terminology called Permandor Technique, where you take a break for every 25 minutes or 30 minutes. So if the class is going to happen for 1 hour, you take a break in between at the 25th minute or 30 minute, a break for 5 minutes. The break can be used to have a coffee, to drink water, or to do some exercises being seated. So this can be considered, and this will improve the performance of the kid during the class. So the breaks can be helpful in physical and psychological benefits are there, which can happen in every 20 to 30 minutes. And what is the ideal sitting posture for the children? So generally, we follow the rule 90-90-90. So if you note here, the hip is placed in 90 degree, the knee is kept in 90 degree, and the ankle foot is also kept in 90 degrees. So by keeping this way, you are avoiding strain to the low back, to the knee and the foot. So this is the ideal 90-90-90 posture, which has to be adopted in every children. And this image shows the incorrect and correct posture. See, the right side, the back of the individual is kept as close to the back of the chair, and the foot is rested well. Whereas in the left side, the individual is hunching too much and also tilting to the sides. So during the childhood days, we should constantly, voluntarily follow this posture, so that when in subsequent months and years, we develop a involuntary correct posture to avoid the subsequent damage to your back and the neck. And these are the common mistakes. So we try to slouch back. When you slouch back, the strain comes to the lower back region, and we develop a low back pain early. And when you hunch forward, you develop a shoulder and neck pain in the early days. So these things to be avoided. And this image shows an illustrative diagram where the chair is height adjustable, the table is height adjustable, and the desktop is tilt adjustable. So based on the kid's height, you adjust the chair first so that the knee is kept in 90 degrees and foot is rested on the ground. Then you adjust the height of the table such that the elbow is kept on the platform of the desk, so that it won't be hanging on the air to avoid strain to the shoulders. And you can tilt the table according to the need. If you're reading, you can tilt up to 30 degrees. If you're writing, 10-20 degrees. So accordingly, you can change the tilt of the table. So such tables have come in the market, which will be more useful for long-term usage of the system. Even this can be used while reading for long hours. And these are the images of height adjustable and tilt adjustable desk and chair, which is currently available in the market. And so the chair design, it started for many years. The evolution is happening. So from 1904, you see the design of the chair and see this current designs. So the chair which has been shown in the picture is a kneeling chair, where the knee joint is kept flexed, and such chairs will give you the active sitting experience. And also the ball, the exercise ball is kept in the right side. You can see both the chairs have an exercise ball as a platform, where this will allow and encourage the active sitting. So you won't feel the fatigue and tired during long hours of sitting in classroom or working or reading. And this picture will show you a lot of ergonomic workstations with accessories. See here, there are sit-stand chairs available, and the bike desk is available, and the treadmill desk is available. So to go through this, a lot of things are there, which has been customized according to the individual need of the persons. So what is the take-home message? See, generally the ergonomics has been described or developed for people who are working, and even there are ergonomics for sports individuals, for leisure activity, for professional people. So the ergonomics for children has come into importance last 2 years. So because we see a lot of patients coming to our OPD, the school kids, college kids, coming with back pain, neck pain, shoulder pain, all the problems which we were seeing in the elderly, now it has started coming to the school children. Why? See, because we are not following ergonomics. Even in school, many schools won't have a ergonomically designed chair and table. See, we fix a common table for everyone, but the height of the individual will vary. See, the kids will have different growth spurts. Generally, an average kid will grow 2.5 inches every year. So, but whereas the school bench and desk will be static, which has been formulated and the school has been built. So probably that may not suit them. But now, being online classes, so now we can customize the chair and table which we use at home. So there are ergonomically designed chair and desk available. So which we have to create a comfortable workstation. That is the station where the children are occupied in classes, which will make them be more attentive and which enhances the performance in their classes. and we should make them learn about the dynamic sitting, which is the active sitting which we have demonstrated earlier. And when they are going to the school, the optimal backpack concept will come into play. And also they can use the Permandor Technique while attending classes or reading in the system, where they should take a break every 25 to 30 minutes and then take a break for 5 minutes, where they can completely off the task and they do whatever they want. They can walk, they can breathe, they can drink coffee or juice accordingly. Take a break for 5 minutes, then restart your classes or study, which will enhance your performance. And by following the 20-20-20 rule, you can avoid the eye strain. So whenever you are exposed to LED screen for 20 minutes on average, you take a break for 20 seconds and stare a wall at 20 feet away. Just stare blank. Then you can restart your work. So which will avoid eye strain and subsequent headache problem in the future. And by following the 90-90-90 rule, you can avoid the development of back pain, neck pain, strain to the shoulder and the low back. And I would like to show you this video. Probably you would have all seen this movie. I guess no one will say no. So this movie, this scene has a lot of ergonomics in this. See, the Shivu, the so-called the son of that lady, the lady wanted to pour water to the Shiva statue, which needs more effort and strain. Whereas the son designs ergonomically, and so he lifts the statue to the water. So by making the mother more comfortable and stress-free. So the ergonomics is involved here. And also, if you see how he carries the statue, he carries close to the body and keeps the statue over his shoulder. So there is also the ergonomics is followed. So ergonomics is followed everywhere. Now it has become a lifestyle. So it is nothing but creating the environment where whether you study, you work, or you play, or it's a professional sports, should follow ergonomics everywhere. So avoid injuries. The injury happens commonly because we are following poor ergonomics everywhere. For example, Sachin Tendulkar had tennis elbow for years together and he was suffering. Why he developed tennis elbow? Because he carried a bat which is too heavy, heaviest of all cricket players. So he met all the doctors of the world. In fact, he met all the top surgeons of the world. Everyone advised him to carry a lesser weight bat, which probably he was unable to, because from the childhood days he was carrying the heavy bat and he learned that way. So Sachin Tendulkar in fact retired due to the tennis elbow problem. So he failed to follow the ergonomics in the childhood days, which subsequently is unable to practice the lighter weight bat while playing cricket. So tennis elbow, he underwent 3 surgeries. In spite of everything, he couldn't get relieve the pain. So ergonomics starts from the childhood. So I would encourage you all children to follow ergonomics in your classroom, in your house, whatever you do, whether you paint, whether you read, whether you attend classes, or even in sports, you follow ergonomics. And now I would like to introduce our chief physiotherapist, Sriram sir. He will teach you some exercises. And at the end of the session, we'll have an interactive question and answer session at the end of it. Thank you for the opportunity.
Okay, good afternoon to children. Today let's speak something about ergonomics for online classes. Okay, I'm Sriram. I'm working as a head of the department physiotherapy, Sri Ramakrishna Hospital. Okay, So let's directly go to the classes. Okay. So here I am going to speak of really of two terms. One is your posture, other one is your ergonomics. The posture relates to the term in which someone holds the body when standing or sitting. The term is referred to as posture. The ergonomics is a term which is designed for the efficiency and comfort in the working environment, so that the productivity or efficiency of the students or their workers or everything, it will be increased. Okay, the major problems of the students which are facing during online educations are pain, eye strain, headache, and fatigue. I'm just addressing on these factors, and I'm going to speak on these factors. The position of gadgets, that is laptop, desktop, and mobile phones, sitting postures, room brightness, use of audio devices, exercise, eye, food habits, screen time, and size. So I am going to speak on these key factors. The first, which is I'm going to speak on, is the position of the gadgets. So which we commonly use the gadgets for the online classes are your desktop, laptop, and tablets. Apart from all these things, the desktop is an ideal thing for your online classes because it's ergonomically designed and efficiency of the students or staffs can be increased, whereas the laptop plays a vital role when in the presentations or preparing the classes for half an hour or 1 hour. Maximum usage of the laptop will be half an hour to 1 hour. But in the case of desktop, you can use for more than hours because laptop is not ergonomically designed. Whereas the tab, it can use for a maximum of half an hour, but not more than that. Okay, these are the normal postures which we adapt during our online classes, that is lying down in the bed, sitting in the stools, or sitting in the sofas, or sitting in the floors, sitting in the outdoor activities, or sitting near the sunset classes. Okay, these are the normal postures which we adapt during the online classes. So the doctor has explained you about the correct sitting postures. Okay, these are correct sitting postures where the chair should have armrest, chair where your elbow should not hang. If the elbow hangs, it strains your shoulders, and your knee and hip and knee should be flexed and the foot should rest on the floor so that the strains to the back should be reduced. And if you are using devices of laptop or desktop or things, we should modify the devices for the proper ergonomic advices. Okay, in case of using of laptop, you can keep a height. The laptop can be used as a screen, and you can get an extension keyboard and mouse. With the extension and keyboard and mouse, you can work on the systems. Okay, where it strains less strains to the muscles. Okay, these are some of the modification devices which you can adapt in the home. Okay, so in case of children, if you are using the low desk and high stools, it strains the back a lot. So in that case, you increase the laptop or height with the help of books or something like that. So increase the height and get the extension keyboard and mouse, and you can work it on it. Or if you are using a high table, okay, make sure that foot should not hang the floor. You can have some blocks and keep the foot over the block so that it will not strain the back. Or in the case, you can increase the cushion height of the seat cushion of the height so that the children can place it comfortably. So these are some of the device modifications. Why device modification plays a vital role is your device or screen should be straight to the eyes, where you should not have bend in the neck. If you bend down and look for a long time, it strains the neck to a lock and you land up in neck pain. So these are the devices which are available in the market where you can keep the neck straight or erect and you can have a look at the screens. So next, we are going to speak on your room brightness or lighting. It plays a vital role in online education. The brightness of the room should be optimal. If there is excessive brightness, the screen clarity will be very, very less. If less brightness, it strains your eyes and it causes fatigue. So it's determined by many factors, sunlight, such as your sunlight, floor, wall, and paintings. So ideal position of the light should be between your screen and us. The study light or overhead light can be a better choice. Any shadow of the object should not fall on the screen. If it falls, the screen clarity will be very, very less. So next comes your audio devices, which we follow is earphone, headphone, external speakers, and mobile speakers. In all these four, headphone plays a vital role where your external voice can be avoided, so you can keep the volume minimal, so it can minimize the damage to the eardrum. So by the deafness can be prevented. Apart from this, you can use your mobile phones, speakers, or external speakers, which is very, very good apart from this. So exercises plays a vital role. Why the exercise plays a vital role? Because of the online classes, the children are sitting in an abnormal posture for a long time. When the children are sitting in the abnormal posture for a long time, it causes excessive stress to the muscles, thereby the muscle pains are more. So to prevent the muscle pains, so the break exercises are performed during the online classes. The break exercises or exercises should be performed for every 1 to 1.5 hours to maintain the normal posture. Some of the break exercises are get up from the chair, go around to 30 to 40 steps and get back to the chair. Break up your sitting time by using restroom, filling up of the water bottle, or grabbing a snack. Stretch up of the shoulders, spine, and rotation of the spines. Full squats can be encouraged. Raising the hands overhead. Rotation of the head clockwise and anti-clockwise. Shoulder rotations and spine extensions can be encouraged. So these are some of the break exercises where you are bending your neck forward and backwards. You are rotating the neck to sideways, and you are elevating the shoulders, and you are retracting the shoulders, where because you are always trying to be in a forward positions. To prevent the forward positions, you go for the shoulder retraction exercises. So this is the arm circle. This is the cervical spine rotations. This you should do it on both the sides. This is a leg raise. This is chair squats, getting up and sitting down in the chairs. And this is a desk dip. These arm curls. This is a calf raise. This knee lifts. This is spot jogging. This is hip extension. This is cat and camel exercise. So next, which we are going to talk is on about food habits. The healthy food should be consumed. The food which are rich in proteins should be encouraged. Have plenty of water. Junk food should be avoided. Have lots of fruits and vegetables. And next, which we are going to talk is on eye strain. When the eye strain is more, that is fatigue, our posture will automatically tend to go into the forward posture, that is your kyphotic position. When there is a kyphotic position, it gives strains to the neck a lot. So this will be a triggering factor for your headache and neck pain. What we want to do to prevent the eye strain is minimize the brightness of the monitor screen or gadgets or below the 50%. Distance between the monitor and us should be 20 inches. Because of online classes, our blink reflexes will be reduced. So if there is a reduced blink reflex, the moisture to the eye and eye muscles are reduced. So the fatiguability of the eye will be more, and it will lead to the chances for your specs. So actively you should blink your eyes minimum 5 to 10 times per second, just per minute. And in case if you are using the mobile phone, use full screen view to reduce this eye strain with the mobile stand. And you should avoid the rooftop. Massage in and around the eyes. Drink plenty of water. Proper rest to the eyes by being out of the electronic gadgets or closing your eyes for some time, and your regular eye exercises. And next, the screen time and size. More the screen time at a particular stretch of time, the more strain to the eyes. At a stretch of maximum 90 minutes can be allowed, followed by a break, and then continue to the work. The bigger the screen, the less strain to the eyes, and smaller screen size, more strain to the eyes. That is, example is your mobiles and tabs. So thank you. Yeah, now you have any questions, you can just post to us, sir. We are here to answer you.
Hope this session was useful to you children, and simple take-home message is
Dr. Gokula Krishnan and Sriram, that was such a wonderful session that we had. In fact, we were wondering as to are we doing the right things at school, because even ergonomics is something that, as you said, it should become a practice of life, for the simple reason that today children suffer not because of academic pressure, children suffer because of bad postures. And the right demonstration of these postures are not given any clarity, both at the home level or at the school level. The reason being, children in a classroom for 40 minutes, the teacher expects the attention to be there for quite some time, and anyone, like when any child is getting distracted or making a slight movement, the teacher feels that he's not paying attention. This was the scenario in a physical setting. Now, when we move to this digital classrooms, virtual lessons, online classes, there's absolutely no control of the postures. When we had a slide on the bad postures or how children attend the online classes, I was taken by surprise, because it is not just the students, even some of the teachers. I've seen them, like when I just walk into the classrooms, the digital classrooms, and you find them, even adults, doing that. I have representing the entire fraternity of Manchester International School, and to all the parents, my question to you is, this COVID-19, this pandemic situation is going to be here for some more time. It's not going to go out any soon. And the digital classrooms are going to continue. Now the children have been used to this kind of a scenario where for the last 8 months they have been glued to a place, to different postures, and have developed a habit of their own. Getting them out of it is going to be a difficult task for us because we don't have control on them. Now again, we are going to extend this digital classroom for some more time or some more months. As experts in this field, what are your recommendations when it comes to how a class can be structured or designed by the schools in particular, so that when we schedule a timetable for the students, we take care of that? Now, for simple reason, what I'm saying is, like, for the senior classes, we have classes starting from 8:45 in the morning till going till 3:30 in the evening. Of course, we give them 5 to 10 minutes of break. But then some teachers, like, oh, you have the 10 minutes break, let me continue my class. And they just extend the 10 minutes. And by the time the child is not given that, the freedom to just 3 times before he gets into the next class. But this doesn't happen with the smaller ones, because whether the teacher is continuing or not, if he wants to take a break, he takes a break and he moves out. Considering all these factors, what you said, I think as a head of school, I have a prime responsibility to make sure that the right posture is given to the students. For that, the scheduling is very important. What are your recommendations for a school to consider when they schedule a session for the children?
It is simple, as we have seen the height adjustable furnitures. So because in the same class, children might be at different heights. So we have to design the height adjustable furnitures, customize the furnitures. So you cannot fix the same table for all the children, all the schools, same class. So you buy, if the seating arrangement is individual, henceforth, so the individual height adjustable chair and the table will be of great help. So that based on the children's height, you can adjust the height of the chair and the desk so that they won't feel the discomfort. So probably a single long bench and chair, where when I was a school student, we used to sit 5 people in the same bench and chair.
This is possible when the children are coming to school. When they are at home, like when as a academic coordinator, my middle year program coordinator, he schedules a timetable for the child without any break or with break or whatever. But what else can be done so that the child gets some kind of relaxation? As you said, exercises is one way out of it. But what other things can be done so that we take care of these factors while scheduling the timetable?
See, you don't make it a long class. Maybe the session can go up to 30, maximum 40 minutes.
All right.
See, beyond that, looking at the LED screen, so for example, let me tell you, see the LED exposure, when a healthy individual getting exposed to LED for long hours, let it be a system, let it be a laptop or a TV or even mobile phone, there is a study where when they get exposed to the system for more than 8 hours a day, if they constantly exposed for a month, even it will trigger an episode of epilepsy, that is the fits. Even the individual can get a fits. So it will stimulate the neurons of the brain and it will cause an epilepsy, that is a seizure, commonly called as the fits. So minimize the LED exposure by taking break, 30 minutes, maximum 40 minutes. Let each session go up to 30-40 minutes. Beyond that, when it goes, the patient, the student may not be attentive. So, and naturally, the physical strain will be more, the eye strain, everything will be more. And end of the day, the class, which probably the teacher has to, the take-home message given to the students might be, not accepted completely or taken completely. So, you design such that, you let it go up to 30-40 minutes and make sure that there is a physical session. Even I have 2 daughters in my house. In their physical education program is happening, the teacher might be, sincerely conducting the class, but my younger daughter will be sleeping and switching on the mobile, the online platform. So which is not correct. So we should emphasize, the parents should emphasize the children to perform exercises. The core exercise is very important, to keep them to attend the class online for long hours. And so that you give a break for 30 minutes or 40 minutes maximum. And like that you plan. Or in between the classes, you make sure that they do some exercises for 5 minutes. Simple exercise, what our therapists have taught them. Those exercises are more than enough for keeping them attentive.
One question that suddenly came into my mind was, boys and girls have separate, the physiological differences. The anatomy is entirely different. Do they need to take care? Like, for example, a boy, they have a very casual way of sitting, and nobody bothers about it. And the moment a girl tends to sit like that, we say, no, you're a girl, no, you need to take care of how you first dress. Does this, this first dress or any particular style that they do they affect the genders differently, or is it the same for everyone?
There is no gender-specific difference. Okay? Actually, it's individualized. See, there is no hard and fast rule to follow a posture. See, it is my convenience to sit in whatever way. See, so it is individualized, whether boy or girl, that does not matter now. See, you should keep all the core muscles, in action most of the time. So that is the ultimate thing, which won't happen just like that. It is a habit. It should be made as a habit. So we have to train them by doing regular exercises and constant, voluntary sitting. That is called active sitting. You make sure that you sit upright and comfortable. By doing that over a period of few weeks or a few months, they eventually develop that habit of sitting in a comfortable posture. And there is no gender-specific difference to be, advised. It is individualized. What's the term?
Yeah, exactly.
No, any exercise? Do you have anything to say, Dr. Mr. Sriram?
Outdoor activities, outdoor exercises plays a vital role. By evening, you can cut short your homeworks or something like that, and encourage the children to go for outdoor activities.
My children will be happy to hear that.
By saying that, outdoor activity, let it happen after the class. Okay, so
right.
In between the classes, in between the session, you make sure that you give a break for 5 minutes. Let it not be a continuous session.
All right.
Give a break for 5 minutes. That 5 minutes can be advised to use for exercises or a small walk.
Going to restrooms and coming back.
Simple exercise. Let them be seated in the chair and then let them do exercise, or let them be lying exercise up there on the floor. They can practice. See, all young children, so they can do even yoga. Yoga plays a major role. The yoga asanas, let them like that.
We were planning to introduce, we had all these physical education, dance and yoga at the start of the year, but then parents wrote a mail to us saying that, our children, for that also they need to sit before the screen, and plus your additional classes. So they wanted us to remove all these things from the schedule, so we were forced to do that. But then now I realize that it is not much about the content what they learn. It is about the right living, that what they should be learning for them to survive. When we have seen the pandemic, those who have toned their immunity to that extent are safe, and those who have not been so careful about their lifestyles have gone through a mess. I'm not making a very candid statement, but this is what we generally understand. Now, going back to something, Doctor, traditional classrooms, like even I've seen one of the schools here in Coimbatore, an international school, children squat on the floor and, while they learn. It's mandatory for them to, especially with core subjects like sciences and math. I've seen the classroom. I was fortunate enough to go to one of the classrooms a couple of years back. Children, they don't have chairs and desks, but they have this, they squat on the floor, and they have the small, a small table in front of them, and with an open desk, like the ones you find in the traditional, traders, they will have it. So that's what they have. Do you think that going back to roots is the way forward? Because everything now we are going back to, because the amount of people are like, we are the kind of herbs and lifestyles which we discarded a couple of years, decades back, we are going back to that. like we were not used to it. But today people are just craving to have it. So we are going back to roots. So is this also kind of going back? Should classrooms be designed for future like that?
If we want to adapt a new method, like the old method we want to bring in now, so it should start in the early classes, that is less than 5, standard 5 and less, maybe you can adopt. Because when the child attains that growth spurt, the physical size might differ. Not everyone can adopt that squatting posture for long hours.
Right.
If at all you want to start such things, maybe you start the early, start from the kindergarten. When they go to next level, then you continue that. So like that you can start. So that training early is easy. Always the children during the younger age, the bone is still, it is malleable. Though a bone is called as a rigid structure, still it has an elastic nature, which will be more, pliable and bending. And till they attain that skeletal maturity, the early days is malleable and soft. So any posture adaptation can be introduced in the early classes, maybe not in the beyond standard 5 and all. If at all you want to start during kindergarten or standard 1, 2, 3, 4, you can start. That can be considered in collaboration with the parents' opinion and all. Sure. It is no harm in actually. It is, in fact, it is good to train them early. If at all we want to bring a change.
We have had a very informative session, Dr. Gokula Krishnan and Sri Ramakrishna Hospital. We've had so many webinars and seminars in the past, and I'm sure that this is one of the best sessions that we have had so far. Relevance is what makes any session significant. Today, the session was so relevant for to ensure that learning is all about preparation of life, and one of the ways of preparing yourself of life is to have a healthy lifestyle that includes considering human factors. Since we are running short of time, children, what you can do is, if you have any questions, please mail us and we will direct those questions to Ramakrishna Hospital and we will try to get responses from them, and we will include those in while considering planning and scheduling the sessions for you. I thank from the bottom of my heart the entire crew of Ramakrishna Hospital, Ms. Purnima, Mr. Umashankar, and of course I need to thank Mr. Anmol from L-Basics who started the seed first, and to all of us and my management, Dr. P.S. Murthy, Mrs. Priya Murthy, the Director of Marketing, Ms. Vaishwarya Murthy, and my entire management and fraternity staff, faculty, students, parents, and everyone. This one session, I didn't find anyone leaving after. They were all attentive. Right from the beginning, we had that number and it's still going strong. So I'm sure that these sessions with the Ramakrishna Hospital is going to be to see more fruits in the future. If there were any parents, do you have any questions? Like I can just take one or two questions. I think if Mr. Gobal Government, we can take Dr. Gobal, just one or two questions. Any parent would like to have some questions?
And I would like to add this point. See, I'm practicing for the past almost 20 years now. See, I'm one person who will insist my patients, when they come for back pain, I train them exercise for the neck and shoulder and knee. They used to wonder why this fellow is telling when I come for back, he's teaching exercise for the neck. See, because it's all the degeneration. The degeneration is an ongoing process. The wear and tear, which won't happen in one fine day, but the manifestation will happen in one fine day. See, suddenly we get a neck pain or back pain or shoulder pain, but the pathology, that is ongoing process, the repeated micro injury, it's called repeated micro trauma, which will happen the policeman who's standing in the traffic, standing long hours, they develop a varicose veins in the subsequent 10 years down the line. So likewise, school teachers who are standing, they also tend to develop varicose veins in the future. Right. So likewise, every profession will have its own occupational hazard. So how to escape those things? See, Simple formula. You start doing the core exercise earlier. That is, younger age. You should train the students, whether boy or girl. So you should train them to do certain exercise every day. Every day means at least 5 days a week. 30 minutes minimum to be spent. So by doing core exercises, the wear rate, the degeneration is being completely postponed. You cannot prevent it or escape it. But definitely we can postpone it. See, often I see people, middle-aged women coming to me with back pain, neck pain at the age of 35, which we were seeing at the age of 55, 60, 70. Whereas the degeneration is happening more early these days. Because why? Women or men, generally the middle age, up to 35, the bone will have a density going up. From 35, it will decline. So how to maintain that the maximum bone density for longer years? Only by doing certain core simple exercise. See, sports, involving in sports is not the exercise, it is an entertainment most of the time. See, even sports, no, I see a lot of injuries. See, we have a SNR Sports Academy, the CSK 2 players are from our academy. See,
okay.
Harinishant and Jagadish, 2 players are from our sports academy. And in fact, I'm the official SNR cricket club, I'm the official sports doctor. See, because I myself, I used to play 3rd division and Chennai 2nd division. I'm a left-arm bowler, right-hand batsman, and I'm a football player and athlete too. Touchwood, I'm 43 now. Till this time, I've never sustained a major injury, though I have sustained small minor injuries. Because I do the core exercise before starting my game. See, even in professional sports, you should do the core exercise before you start the game. Then only you can escape injuries, or that is your best effort to escape injury. So please, children, you try to follow. Even for the parents who are watching now, see, I would recommend them to start exercises every day. If you want to avoid meeting us often, that is the only way. So, and weight management, another thing which often I see, overweight. See, this lockdown, even I have put 8 kg weight. And with my help of my wife, probably I reduced it now, gone back to the same. So, but the thing is, weight, this lockdown is, many people have put the minimum 10 kg weight. So please try to cut down your extra calories, you form junk food. And probably everyone with so much free time, seeing online cookeries, everything, and they start preparing new dishes and they happily eating and putting weight. And end of the day, they come to us with the back pain, simple problems. See, avoidable problems. See, the worldwide research is happening. See, every day, joint replacement surgery happening in the world, millions and millions of dollars are spent for joint replacement surgery. So the research is happening in every developed countries, how to prevent joint replacement, or in other words, how to prevent arthritis. So that is the research happening nowadays. So simple 2 answers has been derived. One is optimal weight for the height that has to be achieved early, and the second one is to do the core exercises. See, neck means neck has core muscles, back, shoulder, knee. Likewise, every joint and every part of the body will have core exercises, which our therapy department is one of the established first physiotherapy college is ours, and we have a trained big unit of physiotherapy. And so we always insist when the patient comes for knee pain, we start neck exercises. So we try to aim for preventing the problem. So that is the way it should be. So for school children and parents, so weight maintenance and basic exercise very much. And ergonomics, naturally, what is ergonomics? It's nothing but it is comforting oneself at their work to reduce the injury. So you make sure that you are comfortable in your classroom or online classes, or even when you're a homemaker, you're preparing dish, whatever. See, it's individualized. You create your own ergonomic situation. That's it. So, and I thank the Manchester School management. I thank Swati Madam and Health Basics for giving me this opportunity. So, thank you, sir. Let us meet as often like webinar, not as a patient. Not as a patient.
I request Ms. Aishwarya, the director, is here with us. Do you have anything to add on, or do you want to comment something, Ms. Aishwarya?
I just like to say thank you. Thank you for the session. It was very informative. I'm sorry I joined a bit late, but it was very informative. And like you said, we'd meet more often virtually.
Yeah.
And thank you, Rajesh sir, for this wonderful session, organizing this.
Pleasure, pleasure, pleasure. Prince Joy, one last question from Prince Joy.
Sir, how to keep our muscles active when we are attending online classes?
See, this won't happen like we are not all robots where you can switch on the, switch it on, keep the muscles active. See, it is a habit. You should inculcate the habit by doing constant exercises voluntarily. When you're attending classes, there are certain active chairs available. I've shown in some images. So you can search for the online products available, or you can even go directly. See, there are certain active chairs available. Let's say, see, the rocker bottom chair is an active chair. So when you sit on a rocker bottom chair and attend the class, the rocker bottom will keep your muscles always in taut condition. So the core muscles will be in contraction all the time. So likewise, there are standing sit chair. There are a lot of designs are there. So for your question, you have to constantly practice this habit. So not in one day you'll get there. When you constantly practice it every time and again, over a period of time, you develop the habit of active sitting. So you'll constantly keep your muscles, or take a break in between. Once the one session is over, our therapists have showed some videos. You practice those exercises in between. And yoga is one of the best exercises which you learn yoga and practice every day in the morning. The first thing to do in your day.
Thank you, sir.
Thank you so much, all of you, for attending this. Thank you, Ramakrishna Hospital. Thank everyone from the bottom of my heart, and Manchester International School is always there for the students and for the welfare and well-being of all its staff as well and the parents. Thank you once again. Thank you so much.
Thank you.
Thank you, sir.
இங்கே என்ன பண்ணுறது ரெக்கார்ட் போயிட்டுருக்கு